Good afternoon, everyone, and thank you very much for joining us for this event. We're really excited about the discussion today, and we've got a really packed agenda, so I think we'll probably get through it quite quickly. I think we'll probably start with a little bit of a presentation, which I'll split between me and Chris. For those of you that have been here before, you'll recognize Chris, and for those of you who haven't, thank you and welcome to this latest piece of research. I'm going to share some slides now, and we can chat through. Okay, so I'm going to start by just telling you a little bit about Future Care Capital in case you haven't come across us before. We are a charity, research organisation and think tank. We span both health and social care, and we're really lucky to be able to work in some really exciting areas. We predominantly focus on data, technology, innovation, climate and investment. And we've had quite a few different bits of research and pieces published recently. One sec. Sorry. And yeah, this is the next piece of research in our series about learning about social care technology. We're really lucky to have an excellent series of partners across our different work streams, and we're always looking for new partners and new people to work with. So if you like the work that we do and want to work with us, please do get in touch. At the end of this presentation, I'll leave a slide up that has some contact details, so you'll be able to get in touch to find out more. The present session is about our latest piece of research, which is focused on learning disability care technology. It's the third installment of a series of 4 pieces of research. So we started with home care technology, then we moved on to mental health care technology, and then there was this one, and we'll conclude the series with residential care. And after we've looked at all of the areas, we'll publish a sector overview and think about some of the next steps and how we can grow the sector and support more innovators to develop solutions in this space. So this is the overall picture of social care and adult social care specifically. And it was quite interesting when we were designing this research. Initially, you'll see here, we looked at disability care overall, but then there was so much out there and things were a little bit fragmented and quite different across the board. So we took the quite difficult decision quite early on to focus specifically on learning disability care. And I think that was actually a really good decision and meant that we learned a lot very rapidly. I think Chris will agree with that. All of the technology that we're looking at here and across the reports in the series relate to this technology stack that you can see now. And we need to think quite carefully from the different perspectives of different user groups, whether that's the primary users who are engaging with care services, the workforce and people providing care services, and then there's also developers who are developing the technology and solutions that we're covering in the research. That went on a bit quickly. So you can see that there's a few different layers here, and through this research, we're focusing very much on the top layer here of interact, analyze, and inform, and making sure that we're focusing on the technologies that can really improve people's lives and help, in this instance, not just with the provision of care, but also access to care and thinking about how people can live healthier, better, and more enriched lives overall. So I'm going to pass over to Chris now to talk through some of the findings of the research. And then after that, we will move on to our discussion. So Chris, over to you.
Thank you for the introduction, Peter. So to provide a little bit of context about the report, what we were trying to achieve is, there were broadly four things that we were trying to achieve. One is to provide a snapshot of the technologies in development in England at the moment, to provide an understanding of the trends in learning disability technology pre and post-COVID, and to describe the opportunity for technology in this sector, and to conclude all of that by making recommendations on how to stimulate market growth to policymakers. So in terms of what we actually found, there were 19 companies that met the report criteria. And to be honest, this was far fewer than in previous reports and less than we had expected. So we had found 56 technologies in mental health and 49 in home care. And even though there were fewer companies, some of these had created multiple products. So there were 25 products that we assessed. 6 of them were platforms, 5 were IoTs, Internet of Things, and 14 were apps. And you will notice, if you look at that donut chart, that most companies developed applications and consumer technologies for use in the home, suggesting that this is an early stage and underdeveloped market. And we expect that the types of technologies that are in development and that are available will diversify as the market matures. It's, I guess, unsurprising that there are so many applications, as smartphones may be a more affordable and accessible option than laptops or tablets. And on investment, it's, I guess, interesting to consider that there were only 5 companies that had funding information, and the average company investment was £400,000, which was a lot lower than other market niches in health and social care. So to provide some comparisons, the average software healthcare company receives 3.4 million in funding. And in home care, this was still 800,000, which is double what we found for this report. And if we look at the geography, there were fewer companies than in previous reports, but quite interestingly, they are quite evenly spread out across England. And it might be the case that these technologies are not crowded around your usual innovation hubs due to a lack of established sort of central funding mechanisms. So if we can go to the next slide, please, Peter. So for our research, we segmented the technologies by function, and we identified 3 main groups that I'm just going to very quickly talk you through now. The first one's accessible communication. This is quite self-explanatory, and it includes any technology that helps individuals communicate or access information. So this might be eyesight tracking or image association for nonverbal individuals, or text-to-speech converters, such as for sight me. We also have cityboss there because it is a really interesting platform that provides accessible information on how to get from one place to another. And I'm sure we'll hear a bit more about that because we have someone from the company in the panel today. And this was the largest technology group, suggesting that these are some of the most common technologies that are being developed in learning disability at the moment. Then we move on to remote monitoring, which includes technologies such as fall alarms, telehealth, or FaceTiming, all of which can help to monitor individuals with learning disabilities in their own homes. And this group of technologies, quite interestingly, was originally developed for the elderly and has subsequently been adapted for users with learning disability. And once we removed all the technologies that were specific for the elderly, there were only 3 companies that were actually targeted their products to users with learning disabilities, which is quite interesting. And finally, we have agency. Now, this group of technologies is a bit more of an assortment, but all of the products that we included here ultimately help individuals exercise their agency. That is, they empower them to make their own decisions in their everyday life. And the kind of technologies that we saw were step-by-step walkthroughs, memory aids, or one of my personal favorites, an app that helps carers understand and uphold the human rights of the individual with learning disabilities they're caring for. But I think it's also worth noting the omissions and the things that we did not actually find, because assistive technology is a massive umbrella, and these were the only 3 segments that we could find. And technologies that we had seen in previous reports, such as virtual reality, 5G, or gamification, weren't really available in England at the moment. Now, I think it's clear that a lot of thinking went into developing the segmentation, but we're very open to suggestions. So if anyone has any thoughts on how it could be improved, please feel free to get in touch. And if we can go to the next slide. I'm just going to try and go through the take-home messages. Obviously, not everything is included here because it's a 30-page report, but I'll do my best. The first, I guess, obvious takeaway is that, yes, there is an opportunity for learning disability technology to support users to live more independent, connected, and dignified lives. And it can also provide support to workers or medical teams with tools to provide more personalized care. Now, interestingly, some of the most helpful technologies that we found were not cutting edge, they were not particularly innovative or sexy, but they were the technologies that made existing service offerings more accessible to individuals. So it's quite clear, I think, that there are massive gaps in the types of technologies that are being developed. And here, further research is needed to try and understand what kind of technologies are wanted, efficacious, and scalable. And in order to do this, you, of course, have to involve the people that are actually going to use the technology. So user-led development or co-development is crucial, and the use of self-advocacy groups is also strongly recommended. And then once we have done your research into technologies, it's also important to consider how to stimulate further technology development. So here, targeted support and incentives are needed to stimulate the sector. And this can include anything from a relatively straightforward stimulus like ring-fence funding to some more creative or out-of-the-box thinking, such as exploring new funding or access models. Now, I think it's important to consider that a lot of individuals with learning disability are very tech savvy. They're able to use technology, particularly if support is provided. And I think this is the key point. Oftentimes in this community, it's carers and those in support roles that become the enablers or barriers to technology access. And so a widespread digital upskilling program, not just for users, but for their carers and family members, would be really beneficial, particularly if it encourages exploration and independent use of technology by the user themselves. And finally, to encourage uptake, it's important that appropriate support and risk mitigation strategies are implemented. And for example, resources on data privacy are key so that individuals can make their own decisions regarding data sharing. So these are just some of the messages that we found in the report, but I would encourage everyone to read it if they haven't already. Over to you, Peter.
Thank you, Chris. And we'll be making the report available to all the attendees. It is online, but we'll send the link around again after the event. We've already had a question in the chat about sharing slides and things, and I just wanted to mention to everyone that we do record our events and we'll make them available after the event. So don't worry about taking very detailed notes. Everything will be available afterwards. But I would like to say, please do put all your thoughts and questions into the chat. I'll do my very best to address them all. Any that we can't address during the event, we do collect and then we reply to them and email out a response to anyone that we didn't manage to get to on the day. So please do interact. We've got a really good discussion coming up now. So we'll cover quite a few different areas. I won't go through all of these one by one because we'll go through them in the panel discussion itself. But I think I just wanted to highlight the second one, which is around COVID-19, which obviously everyone in this sector has seen a huge amount about over the last 18 months and more. But the data on learning disability outcomes through COVID was one of the things that prompted us to look into this. And we realized that actually there's a huge amount that people access digitally through the whole of COVID-19 in terms of testing, finding your local testing site and vaccination centres, things like that. And thinking about those sorts of things and the role of digital technology in health and care provision was what really raised this in our minds quite early on. And there are some quite shocking statistics in the report that really highlight how outcomes for those with learning disability have been very severe throughout the course of the pandemic. So what if anyone wants to get in touch, please do email me directly, or we've also got our research and inquiries email address. But I think what we'll do now is move on to the panel discussion. So I will introduce our excellent panelists. You've already met Chris, who is the research lead from New Market Strategy. But we're really lucky to work with Tracy from MenCap. So Tracy is the assistive technology lead, and in a minute she'll give a little bit of an introduction to herself and some of her key thoughts and areas in this space that she works on. And then, as Chris mentioned earlier, we've also got Louis on the panel, who's partnership manager at cityboss, a startup working in this space. And yeah, I'm really excited to hear some of Louis' insights on being a startup, developing technology that can help in this area. So what I think we'll do is go first to Tracy, if you want to give your background and a little bit of an introduction and some perspectives. If I end up interrupting you to move on, it's just because we're a bit time constrained. So please do take it away.
Okay, so I'm Tracy Richards. I've worked for MenCap for nearly 10 years, and some of that has been done in direct service delivery. And the latter role was assistive technology lead for the organisation. And we're currently developing a organisation-wide strategy, not just looking at what type of technology is out there, but how we enable and support our teams and the people that surround a person with a learning disability to engage with technology to improve their quality of life. MenCap have a vision to help make the UK the best place to live with a learning disability, a happy and healthy life. And to do that, we know that the world is a more digitally enabled than ever before. There's a parabolic curve of development of technology out there, which, as mentioned before, around COVID-19, has seen a huge rise in the use of virtual platforms to support people, I think, from the doctor's surgery to try and check in when people are isolating. And during that time, we've come to realise that people with learning disability had a double disadvantage because they didn't know how to access some of that technology, didn't have the skills surrounding them to be able to access and understand how to use that technology to remove that loneliness and to engage in society during the pandemic. Other work we've done, we've worked with Vodafone to create or co-create with people with a learning disability that we worked with an application that improves the skills of somebody with a learning disability. And I think through that experience, we are using that as a basis of how we're going to develop our strategy, because the underlying theme was that the people surrounding the person with a learning disability have a huge impact on them, on whether or not that technology will be used. So we're now developing the strategy around how we develop our workforce, how we design a toolkit to support them to do just that, and what do they need, so that the ability to use technology for somebody with a learning disability is supported, but also to raise awareness of what it could do, because they often don't know what they don't know. So we're busy designing that currently, and we're working with a whole case of user groups. So from people with learning disability themselves telling us what they like to use, why they like to use it, using photo voice to get a real grip of what skills they've already got, and then asking our staff the same question about what skills do they have, and trying to marry the two together so that we can start on the basic technology, the everyday technology you and I might use every day, before we start to develop the skills that might use more specialist technologies like the brain in hand and things that you saw on some of the slides before. And that's myself.
Lovely, thank you. That's a really nice overview and introduction to your work, so thank you. Louis, would you like to say a little bit about what you do and what cityboss does and some of your perspectives in this area?
Yeah, absolutely. Thank you very much for the opportunity to be here today. I'm obviously the partnership manager here at cityboss, and we have a mission to make the world more accessible online and offline for everyone. And what our technology seeks to do is to bridge the divide between those who are providing products and services to those who struggle to actually find the right information at the right time in the right situations. And we do that by offering three different products. One is a personalization tool called Assist Me, which allows users with any disability to digest the information that they want to consume on the internet in the way that they prefer to do so. So if you are easily distracted, you're able to pause carousels with images or videos that start straight away or only played once the play button is clicked. It also helps people that have learning difficulties. So, for example, people with dyslexia, you're able to space out words and letters in the way that would suit you, to be able to read it properly. Or if you're even colorblind, you'd be able to change the color of the font to a color that is more visible for yourself. Part of my role as a partnership manager in the startup space is all of us here have many hats that we wear, and I'm involved in a lot of the product refinement and quality assurance because I've had a lot of exposure throughout my life growing up with a disability. I've gone to school with various disabilities, which really highlighted the diversification in conditions. And one of the challenges that we obviously face is when you're trying to create a solution for everyone, there's such a diverse space that you need to cover. And you can't take a blanketed approach because people end up being left on the wayside. So you always have to segregate yourself into certain criteria at a time so that you develop for that criteria and then you move on to the next and you move on to the next so that you can ensure that no one is left out of that process. What that means is that your journey is almost slower because you need to be thorough and you need to make sure that you're able to provide what people need. And the product that was mentioned earlier by Christina, Mobility Map, is really a global platform for people to find accessible locations so that they can plan ahead of time. You know, someone like myself would maybe be invited to a venue, and I'm new to the UK. I've not even been to London apart from one little area where I went for a work function. So if I was invited somewhere, I would have to try and scour Google to try and see whether the venue was accessible, or even phone the venue ahead of the time to say, "Can you accommodate me?" And a lot of the time, people don't find that information. They take the chance and they risk it, and they get there and they find that they actually don't have any access at all, and they have to be lifted up in the power chair. Even that's happened to me many a time. So what Mobility Map does is it allows you to. It, it's almost like a Google platform where you put in the address that you want to see. It will tell you how to get there. So whether you want to use public transport or go in your own vehicle, and it allows us to use our machine learning technology as well to predict places that are accessible. And we're currently in a range of 80 to 95% on the accuracy of our predictions, so that when you're traveling, there's not so much time wasted on planning. You can focus on what you're going to be doing when you get there, and what's important to you is being able to have the confidence that when you get there that you're not going to be stuck. And that's the importance of this space, is making sure that people are confident and can believe that they're able to do this independently, that they don't need a carer to find the information that they need, and they don't need a family member to take them places because um, they might even find it difficult to explain their challenges when they get to their venue. And most of the time, people just turn away and go home and pretend like they never showed up. And this is what we're trying to avoid with what we do.
Thank you. That's so interesting, and I'm really looking forward to asking some follow-up questions in a minute. We've already got loads of questions in the chat, so thank you very much for everyone who's submitted questions so far. Please do keep sending your questions in. I'll try and address as many of them as possible. There's some overlap with some of the questions that I've prepared, so I might just dive straight into the audience questions. So the first one from Lee. Hi Lee, thanks for joining. I think I'll send this to Tracy initially and then open it up a little wider to the panel. But can the panel give advice on any best practice on co-designing with this community, brackets, people with learning disabilities, to get their input rather than their carers who often speak for and on behalf of them?
So thank you for the question. I think true co-creation starts with the person asking them how they want to start, so that they set the ground rules basically about how fast they want to go, understanding any language barriers there might be in terms of understanding, and making sure they're very clear what they want and working around them as a first port of call. Also being clear on what outcome you're looking for, and making sure, particularly for the audience of a person with a learning disability, making sure that any materials that you provide or any resources that you have are in easy read and have options to have it shown graphically or verbally, so that people can fully integrate within the session. And I think one of the biggest learnings from the Vodafone project is it takes time. So however long you think you need, you probably need to think again. And to keep it simple, if you think you've got something very simple, is to go away, have a cup of tea and simplify it again, because that way you're going to get true, honest reactions on knowledge in a way that they will understand and that you will understand. And then you can start to build that relationship. And that's probably the third point. It's about building positive relationship with the client group that you're with, so that they can trust you and that they can feel comfortable if they want to challenge you too.
Excellent. Do either of the other panelists want to jump in on that one?
Yeah, I mean, I'll give our perspective as well. cityboss spent a long time doing research and co-research, and we always involve the end users in our development process, because we have to remember that our understanding of a disability is very different to the person actually experiencing it. And when we don't allow them to give their input, we're doomed to fail. You're not going to be able to provide what you want to provide. You know, this space is very, very fresh in terms of pioneers, and I think that what we need to remember is that this space is never going to have a perfect product. It's always going to have to evolve. It's always going to have to pivot to accommodate those people that raise their issues when they use our technology. You know, when I first joined cityboss, which is just under a year ago now, I really thought that we were set, that this technology is ready to go. And the more we've gone on our journey, we've realized that, hey, we can tweak it here, we can tweak it there, and it's just like inclusivity. I don't think it's an exact science. It's something that is always going to be developed, and there will always be people that find the opportunity to say, this is actually not working for me, and we would like to have it like this, and we need to listen to that. It's very important.
And just to quickly add on that, I mean, I agree with all the points that have been made so far, but I guess I wanted to emphasize two. I think the first one's about capacity building on the sort of technology, sort of innovator side, to make sure that they have enough time and resource and enough support to know how to engage with the person with learning disability in the right way. And I think this point about building relationships, it's really important. And so self-advocacy groups can be a really great way to get to the individual with learning disabilities. But otherwise, just building a relationship with them to ensure that they stay engaged with you during that process of co-development is really important, because you don't want them dropping out because they're not able to, you're not explaining something well enough, they're not understanding something or whatnot. So I think those are key.
Thank you. And I think something that was quite interesting when we were doing with the research was we looked on everyone's website and went through the material that people had up there, and a lot of people were describing their development process. And it was quite interesting to see that only about half of them mentioned engagement with service users in their marketing material. And I don't know how to interpret that a lot of the time, to be honest. I don't know whether is it a marketing thing? Are the others that don't mention it already actually doing it, or maybe Louis, if I come to you, what sort of thoughts do you have about whether or not you describe those processes online?
I think the challenge is perspective. it's very hard to understand how someone is going to perceive the data you put out there. And marketing is all about being attractive, and it's very difficult to show everything in a little bit of marketing. And I think the important value add here is to get the marketing out there that gets the attention. And as soon as someone engages with you, that is when you can start overloading them with the information they need to know. Because we need to remember marketing is not um, a good space to give all your information in one go, because people just get bored and disinterested. So marketing is there to get the attention, and then it's up to you as an organization to really turn that dial for them and show them what you've been up to and how you've done it. Generally, when I'm pitching to clients or even potential partners, that's when that information will come out. That this is how we've done it. This is the amount of time we've spent on making sure that we're able to cater to everyone.
I think that's a really good point. And that there's a really interesting question here in the chat from Lucy, saying, what more can be done to support and enable the work of learning disabled innovators and technologists? A significant group of us are leaders in our fields, working on much needed large-scale digital services, yet we'll struggle to gain funding and resources due to systematic bias and exclusions. I'd be really interested to hear all of your thoughts on that, actually. So maybe, Tracy, if we start with you and then we go across.
I think the issue of funding is universal to all. So from our perspective, most of our care and support is provided through local authority contracts. And when you look at local authority contracts, they often ask a question about what assistive technology you use. And there's often a question in there now, but I feel often they don't really know what they want. So I think until we're clear what people actually want, I think there's going to probably be that barrier still in terms of funding. I think that they say learning disability is the hidden disability because it's not visual, it's not there, it's not in your face. So as such, I think that that the profile of the needs of somebody with a learning disability and the broad spectrum that we're talking about. So we have people who are really very able, very technically savvy, that can use everyday technology, and they're quite happy with that. And we saw that in the Vodafone project, that they rejected the app that we built because they can actually use everyday technology themselves. And that's where our strategy starts, because we need to find a way of doing that enables them to make the most of that. Then you have probably at the other end of the scale, people with profound and multiple learning disabilities who need extremely specialised technology in order to improve their quality of life and to make things easier for them, and to help them to communicate or to do anything. So within that span, there's a huge amount of difference. And I think that's probably one of the barriers. And often I think tech companies want to try and solve a problem. And actually, I think they need to start looking at what outcome do we want to achieve for the person, and start at what outcome you want rather than solving a problem, a need. So I think perhaps once that happens, and you can see the positive outcomes that can be drawn from that, perhaps funding will be shown from government. I know there is lots of work going on at government setting up various bodies to look at assistive technology in health and social care at the moment. And obviously the sort of combining of health and social care in the future is being talked about a great deal. So perhaps funding and opportunities will come a little bit more through that.
Lovely, thank you. And Louis?
Yeah, Tracy kind of covered a lot of what I would have said, but I think one of the challenges that we're facing is that people still have the misconception that this is a niche space. There is a lot of statistics out there talking about 20% of the UK population has a disability, but that's not including the hidden disabilities. It's not including the people who are situationally disabled, and it's also not including the aging population. So it's a very difficult thing to try and show people the value that's there when people don't recognize that it actually exists. So what we try and do is we try to highlight the benefits, as Tracy was saying, and the impact that it can make, and trying to show them how big that space is, because a lot of the the things that have happened in the past is because people think it's a small problem, it gets swept under the rug, and this problem is huge. People are not realizing how many people are stuck in their homes on a daily basis with nothing to do and no way to save themselves, because people don't want to recognize that.
No, I think there is an intersectionality factor there, in that people with a learning disability, thank heavens, are growing older and they're living longer, which is definitely a positive thing. But there is also the complexity of having a learning disability and being elderly. And that is a very different situation to being able-bodied and able to function in an average way and becoming elderly. And I think the technology that we need, younger people need with a learning disability, is more around developing skills. So it feels very much like they finish school and education and technology disappears off their landscape completely. And I think that the technology that they need for the outcomes they want is to improve their abilities and skills, whereas disability technology for the elderly is about maintaining at least of what they've got, and to try and prevent that getting worse, if you like. And it's from two very different angles. So I think that's something that needs to be considered when it comes to funding. And that's why sometimes technology for the elderly doesn't transfer easily, because people who are young, say 23, 24, 30s, they don't want to be using a lifeline like their grandmother uses. They want something that is more age appropriate for them.
Yeah, and just really quickly to build on that, actually, one of the things that we did in the report is that we were very clear that we wanted to focus on technologies that were specifically developed for or marketed towards people with learning disabilities, because there are actually a lot of technologies that could be used by people with learning disabilities, but not many that are necessarily developed for them or with them. And I think that was one of the things we were interested to look at specifically. And it has ended up being a smaller pool of companies as a result, but nevertheless, I think it has allowed us to have some really interesting discussion. I think, when we consider what can be done to incentivize this type of technology development, we talk about funding. And I think here there's some really good points that have been made already about the perception that this is a niche market, or the fact that the perception perhaps that it's not very profitable, when actually there's a massive unmet need. And I think there's about 700,000 adults with learning disabilities that could benefit from technology in this space. But of course, to ensure that a digital marketplace actually evolves and matures is fairly complex, and funding is not enough. There's actually a lot of things that are needed for a market to develop, and that will include workforce development and mentorship networks and fiscal incentives. So it's really a whole system approach that has to be taken, I think.
I think there are some really good points there. And Lucy actually just followed up to say, just to clarify, I'm a tech founder. I have support via Access to Work, but that's not enough at this level. Completely agree. Lucy, I've got your email. I'll probably reach out to you after the event because I'd love to hear more about your work. There's a question from Lorenzo, which is a fairly general question about research and stuff. Reached out to the founder.
Well, you're breaking up a little bit, I'm afraid.
Different companies, and absolutely, yes, we did. So but basically, we reached out to all of the startups that we discovered. It was quite interesting. Not that many people got.
Peter, you dropped out for a second there, so we couldn't hear what you said. Would you mind repeating that?
Yeah, absolutely. Sorry about this. I've been having a few bandwidth issues all day. I think it's we've had every season in a day here where I live, so I think that's probably part of it. But yeah, Lorenzo was asking about whether we have been reaching out to the startups and how we've been approaching contact with them. And yeah, we've tried to get in touch with everyone, and we've not really had a huge amount of success in terms of responses. So it could be because we're going to fairly generic inboxes, or maybe we're being filtered out in spam. But if you're interested and would like to contribute to our work, please do get in touch, because we'd really like to explore these topics further with you. There's a really good. I'm sorry. Am I connected, Chris? You're the only one I can see.
Yes, we could just about hear you for that last question, but it dropped off just a little bit, so it's being a little bit tricky. It might be that Peter has to turn his camera off.
Yeah, I might do that.
Are you still with us, Peter?
And maybe Chris action on my behalf. Sorry about that.
Yeah, sure. I think Peter might be having some bandwidth issues, but I actually have some questions as well that we can consider. So let me see. I guess it would be good to talk a little bit more about this issue of specificity and the fact that the range of different technologies that are being deployed in learning disability, and how different forms of disability have different user needs. I think that's a really interesting point. And, how do you commercialize a product and make sure that it is still relevant to enough people, and it is still profitable for the company that is doing that. So Louis, if we could hear a little bit more from you on that, that would be really interesting.
Yeah, so the approach that we're taking is a B2B level. We're trying to show businesses that they need to take a step towards making the world inclusive as well, and by doing so, it allows them to broaden their target market. And all of our technology that we're offering is free for the end user. So Mobility Map and Assist Me, as long as it's on a service provider's website, is free for the end user. They are not paying to use it. And the reason being is our aim is not just to be based in the UK. We want to provide a global solution. And when you look at countries like where I'm from in South Africa, which is still a developing country, people like myself can't always afford assistive technology. And I think this is why the approach of B2B has been the best route for us. It is a bit of a difficult road to go, because you have to try and quantify to a business what will be their return on investment if they do go accessible. And unfortunately, there's not a lot of people that have gone that route often enough for you to be able to just say, well, look at these 100 companies and look at what they're making now, because they won't understand that it's important to tailor your offering to the person that you're presenting it to. And what we do is we do it on a case by case basis, because the blanketed approach, even when pitching our product, is not going to be applicable to a lot of people that we are speaking to at the moment.
Tracy, I don't know if there's anything you would like to add, and if not, I have a next question lined up, because I suspect Peter is still gone.
Yeah, I think Lewis said that really well.
Okay.
Nothing more to add.
Brilliant. I thought it would be interesting to touch a little bit more on the COVID pandemic and how that has changed the uptake or the development of learning disability care technology in England. So I don't know if you have any thoughts. I suspect you'll both have some interesting perspectives on that. And obviously we looked into that for the report, so I'll be happy to add my thoughts at the end as well.
I think it just highlighted the have and have-nots, I suppose. And one of the biggest things around doing anything digital in this space, including assistive technologies, a lot of it now relies on good Wi-Fi connectivity. And if you are in mid Wales, in the far south in Cornwall somewhere, in a small village, the chances of getting good, reliable Wi-Fi become smaller. And I think that is probably one of the barriers that we found during the pandemic, that and accessibility to device that people could afford, or that they could actually physically understand how to use. And I think what we found was that, as I said before, some people were doubly disadvantaged. Not only were all their day services and the things they did on an everyday basis stopped, and the sort of emotional impact of that, as well as the physical impact of not getting out and doing things that they used to do. And for some people, that's extremely important to be able to keep to a routine, because it forms the basis of their functioning every day. The fact is, they couldn't access the people that they loved. They couldn't access shopping. They couldn't access their banking. They couldn't do all sorts of things they might have done before. And I think that the pandemic has shown that where technology is available and the Wi-Fi signal is good and the support and understanding of how to use that is good, that can actually be very enabling. For example, we know of somebody that we support that has now got a job but working from home, and because of his autism spectrum and learning disability, would never have gone into a work environment of an office. It just would not have, he wouldn't have functioned very well in there. But now he can. So he's now able to work from home, which I think is a really good illustration of the power of what it can do for somebody with a learning disability.
Yeah, I think COVID has kind of shook the world to its core and forced everyone to go digital. And the important part to mention in this as well is it doesn't matter how well you convert your offering to being digital. If that development process hasn't been done accessibly, even someone using accessible technology can still not access that information. So for myself, as an example, is I use Dragon Naturally Speaking, which is a voice technology that allows me to control my device by speaking. So I can open browsers, I can search things, I can navigate through a website. But the challenge that I face is when a website has been developed or a platform has been developed without the web content accessibility guidelines being a core factor to that development process, is I will say click on the home button so that I can go back to the home page. If that button hasn't been labeled, I can't get there. My software doesn't recognize that space even exists, although I'm reading it on the screen. And I think that is a big challenge for people who are relying on assistive technology to help them process information or navigate their way around. And when accessibility is not at the start of your journey, you give yourself so much work to kind of retrofit your offering, and it tends to cost you a lot more money because now you have to almost re-engineer and redevelop things, which is not good for anyone.
Hi, Peter. Welcome back. We were just talking about the impact of COVID on learning disability care technology, and I'll just add my thoughts before I hand back to you. Because I think one of the things that was really interesting we came across in our research during the report is that actually there's not a lot of information about the prevalence of technology use and what types of technologies are being used by the learning disability community at the moment. So it's actually, there is ongoing research in this area, which I think, Tracy, you shared with us at the beginning of the report. But it's quite difficult to quantify, therefore, what the changes have been pre and post COVID. But some of the positive shifts that we heard about was the fact that carers and family members had, I guess, understood, or there was a shift in perspective there about the value of digital technologies and how they could help individuals with learning disabilities in their everyday life, whether that be, the fact that they could maintain social contact through FaceTiming, or the remote monitoring meant that carers or family members could keep an eye on them without necessarily seeing them in person and risking infection. So one of the things that we therefore had as a recommendation or report is to build on this positive shift and formalize that shift through a digital upskilling program to help ensure there's uptake and access to those technologies. So that was just my 2 cents, but I'll hand back to Peter now.
I was able to hear all of the discussion, which I'm really glad about. So thank you all for your insights there. There's a question in the chat that I think's quite a useful one in terms of where we go next with all of this work, and it's from Mark, and he's asking: are there enough connections and opportunities for tech companies, funders, providers, and of course the learning disability community to communicate together and solve this more effectively and drive awareness? Does such a network exist? I personally don't know of any one network that does this at this stage. Mark, I know that you are working with Tech London advocates to develop some work in this space. But Chris, Louis, and Tracy, are there any initiatives that you're aware of?
Yeah, there are. There are a few. They're a little bit disjointed. It's a bit like everything. You have a lot of people doing a lot of work, but they're duplicating work all over the place because that's just the nature of people setting up groups. So the British Assistive Technology Association is one. There's a Technology Care Association as well, TSA, but they are driven by technology providers. And there are big players within that, particularly the TSA, Tunstall being one of them that's not in the report. And Tunstall are really good that they are a big tech provider. They don't design necessarily all their technology, but they certainly source. So I got a frog in my throat. Some technologies, but they cover a whole range of different abilities, and they were set up initially for elderly care and tele monitoring and things of that nature. There's also the Digital Assistive Technology Forum that I'm part of, and that includes Home Farm Trust and then a Cheshire. Sorry, I've got a frog.
If you need to grab a glass of water, Tracy, we can move on to some other questions and come back to you.
I have
go for it, Chris.
If I may, just a couple of thoughts, because I think this point about having somewhere where different people can communicate in sort of academics, perhaps governments, technology developers and users with learning disability can interact and collaborate to develop technology is really important. And one of the things that we mentioned in one of the forwards of the report is that the new Centre for Assistive and Accessible Technology that was introduced in the National Disability Strategy would actually be really well placed to broker or facilitate relationships between these different groups. So I wanted to just mention that one.
I think that's a really good point. And I think something that is struck us when we saw that report and the announcement of that centre is how little funding is available for that centre. I mean, I think it's only about $1 million in total, isn't it, at this stage?
Yeah.
And yeah, I really do hope that gets expanded. In terms of that centre or other initiatives, do we feel that there's a role for those sorts of initiatives and different groups to help to adapt other technologies to the space? So where I'm coming from with this is that we've obviously seen a lot of different types of care technology through the various reviews that we've done, and it was interesting that there aren't really any learning disability associated tools or services specific to the care workforce in this space, but there are in other areas. Those sorts of tools could quite feasibly be adapted to this space with maybe less adaptation needed than something that is user focused. What is everyone's thoughts on that sort of approach?
The World Health Organization have got a group that looks like it's called GATE, G-A-T-E, if you Google that. And they're looking at across the globe, really, and there is work going on. And it's also part of that is with BATA, British Association of Technology Association. I think that there are things out there that can help with providers. There is something called Ask Sarah. It's done by the Disabled Living Foundation, and they've also got another application called Pro Assist, which is more of a professional side of that. But I think one of the challenges perhaps in the learning disability area is that they have multiple needs. Some people have physical disabilities as well as cognitive disability. Some people have mental health issues as well as learning disabilities. They might have autism spectrum disorder, they may have Down syndrome, and all those things, the variety in between. I think that's probably why this is so hard to tackle in many ways.
Yeah, absolutely. I'll second that one. The the challenge, as I said earlier, is it's so diverse that people don't know where to start. And I think it's very important that whilst some of us are competitors in this space, we need to also try and look at ways that we can work together and complement each other, because one organization cannot do everything. And there are things that we can learn from each other that will allow us to cater for this community far better than we ever imagined. Whilst we're all a business and there needs to be a bottom line that's taken care of, I think that there's a far better impact that can be made in the world if we find ways to collaborate and work together. We're looking at someone who's not even in the disability space, but we feel that their technology combined with ours can make us a better offering. And I think this is the kind of mentality that we need to have. It's really too diverse for one organization to tackle on their own. It really is.
I think that's a really good point. I've noticed we're rapidly running out of time, and there's still loads of questions to address. So I think I'll need to take some of those offline and follow up individually. There's lots of really positive feedback about all that information we've just heard on different networks and ways to get involved. So I'll definitely link people up, both in the chat and across the panel, because I think that'll be really useful. I am going to be cheeky and ask one more of my own questions, and this is to Louis, actually. I wanted to ask where this space is so kind of early in many respects for technology. Like, we've seen lots of quite basic apps and in some instances just websites, signposting technology. How do you approach investors and partners as through your role? And do you go with AI and ML first, or does the learning and disability technology itself come first in those conversations? And how do you make that decision?
You see, that's a tough one. You see, it comes down to, again, what I said earlier about tailoring it to who you're speaking to. Investors are difficult to find because they're not always in your space. So the hard work is you convincing them that this is something that's going to get them a return on their investment. And what we always try to do, even when talking to a new partner, is try to show them the value that it brings by partnering with us or investing in us, and what that can mean for them. It's hard when you want to talk about the AI and the machine learning aspect because not everybody is tech savvy and doesn't understand that. Most investors are business minds and not tech minds, so it's really difficult to go with one approach. It's always dynamic, and sometimes we're doing both. We're talking about the benefits and the technology. Sometimes we're just talking about what it does and the aspects thereof. And other times I've seen in meetings where we've spoken about the AI and machine learning aspect of our technology, and that sealed the deal for us because they understood it and they got it. So very important to understand who you're pitching to, who you're speaking with, and what they can relate to, because that's the most important part. Even for our end users, we try and find things that they can relate to, so that understanding is easier as well.
That's really useful and really interesting. Thank you very much. I think all we really have time now for is to thank all of our panelists. So thank you all very much for your contributions, both to the panel and the report itself. So thank you. And we'll be following up with everyone who's put a question that hasn't been addressed. And please do come to our next event. It's looking at the intersection of health, climate, and technology, and looking at the good and bad of technology in that scenario. So please do join us then. For any other inquiries or any thoughts, please do get in touch with us. We're always very keen to hear from our audience and different people that we can engage with. So thank you very much, and see you all soon.